morning, good afternoon, and good evening to all of you, depending on where you have logged in from. My team has 4 members here: Dr. Sutapa, Dr. Nikita, Dr. Jaswinder, and myself. Today we completed the last day of the first month of the project, and we are still working with government of Uttar Pradesh for the approval. And yesterday we have had our ethics committee meeting also. We presented the proposal before the ethics committee. With regard to rationale of an integrated campaign, we are all convinced about how cost effective, how beneficial an integrated public health, integration of public health programs or program components will be, whether they are partial or complete, how beneficial they are. India, our country, is a vast country, diverse country with diverse epidemiological needs, very different population needs. We have many national health programs. The many program components in the form of campaigns continue to happen throughout the year. So it is the same set of health functionaries carrying out these campaigns continuously over a year on the same population, leading to duplication of efforts, duplication of different activities such as micro-planning, monitoring. All these activities are continuously repeated. And some examples, if I say, Pulse Polio campaign, a very successful campaign. It happened for a long time in India, in different locations, national and sub-national campaigns happened continuously in India. There are other national health programs also which have different campaigns happening. For example, long-lasting insecticidal treated net distribution. This comes under the National Vector-Borne Disease Control Program. Camps for testing of blood pressure and blood sugar will come under the non-communicable disease program. So the point I'm trying to make is, so many campaigns happen in different states and union territories of the country. And if we look at many published studies, we can see that these campaigns, when they happen independently, they take up person hours, a lot of person hours, leading to missed opportunities for the population needs. For example, Pulse Polio campaign, one campaign used to take up a lot of time. I've quoted a study here. During the micro-planning stage itself, it consumes a lot of time. And then you have the booth day and the mop-up campaign. So a mother, when you think about a mother who would bring her children for immunization, all the health workers are engaged in Pulse Polio campaign, there is a missed opportunity. So there is a huge rationale for integration, a collaborative, integrated campaign in the Indian context. So we are also learning. It's a new program for us. It will depend on the needs of the states. So we have proposed, in our proposal, the campaigns which we have proposed for integration are the relevant NTD in the state. For example, single dose chemotherapy for soil transmitted helminths. During the COVID period, we all know that immunization has suffered a lot. Immunization coverage has suffered a lot. Childhood immunization has suffered a lot. So childhood immunization also is one of the campaigns that we would like to integrate. We have this non-communicable disease control program, which addresses cancer and other non-communicable diseases. And every sub-center, which is a bottommost level of healthcare delivery facility, which is there in our country, even a sub-center is equipped to measure blood pressure and blood glucose. So we thought this opportunity, when we are bringing the population together, can be utilized to measure to have one recording of blood pressure and blood glucose with a referral if needed. It can be done at no extra cost. Along with that, distribution of COVID-19 related material also. But then the finalization will of course be done with the partners, the local, state and local administration and the partners in Uttar Pradesh. So we have three research questions mainly. The first one is, what is the local landscape that is available for integration of the selected campaigns in terms of infrastructure, human resource, financing, uh, mm, health information, and then logistics. So we will use a WHO framework, the WHO health system framework, to assess uh, this, to address this research question. We'll map all the existing campaigns along with the organization which is responsible, the program which is responsible for it, and then we'll critically analyze it. We'll interview all the relevant stakeholders, the program officers, the local partners, the NGOs, the civil society, the PRIs, the international organizations, etc. We'll use a predominantly qualitative approach to do and do in-depth interviews and focus group discussions to elicit the relevant information. Along with that, we'll also review all the documents, the government and other documents, mainly government documents, to get a picture of how campaigns happened previously. What were the facilitating factors? What were the challenges that previous campaigns faced? And this will lead us to, this will end in a SWOT analysis of the local landscape. And this leads to the second research question, which will be, how can an integrated campaign be planned, describing the infrastructural and human resource commitments, financial resources, and other coordination, collaborative, intersectoral coordination mechanisms. So based on the situation analysis which we do initially, we will uh, uh, have this SWOT analysis with us. We'll know the strengths and weaknesses, what are the opportunities and threats to integration of a campaign, and we'll have multiple stakeholder consultations and meetings to develop a collaborative intersectoral plan for implementation. And we would also, we would have a sort of tool developed to make sure that the integration is feasible. We'll have different variables for that. And our third research question is a little ambitious, that we are trying to demonstrate it, of course, in a limited scale, but we will try to explore ways along with the stakeholders, government and other stakeholders, and with also the civil society, the PRI, etc. We will try to do a small demonstration of this plan, and then we will document the entire planning process. Will be documented, the situation analysis, the planning process, the plan, and also this sort of a limited demonstration, and the lessons learned will be documented. So we'll have stakeholders, a multitude of stakeholders from the government, of course, not only from the health department, but also from other departments. In India, Department of Women and Child, they work very closely with the health department. We have what is known as Anganwadis in every village, which means a courtyard, where the health worker and the Anganwadi worker, they work very closely in delivering services to preschool children and mothers and adolescent girls. So we have this department is also health. Apart from the health department, this particular department, Women and Child, is an important stakeholder. Department of Education, Department of Water and Sanitation, they are all important stakeholders for our integration. State program officers of different programs, state immunization officer, state NTD, the officer who looks after NTD, the NCD officer of the state as program officer of the state, as well as the districts. Of course, the medical officers, the staff nurse, the ANMs, auxiliary nurse midwives, the male multipurpose workers, the ASHAs, the Anganwadi workers, other volunteers, all will be very important stakeholders. The other implementing partners are international organizations, NGOs, community-based organizations, local opinion leaders, the PRI, Panchayati Raj Institutions, and of course, the community members. We feel that the enabling factors is that our health staff are very well versed with different national health programs, because we do not have the typical vertical program as such with one set of staff up to the lower level. Our national health programs are well integrated into the general healthcare delivery system. So our health workers are quite well versed with the different campaigns and different programs, because they are carrying them out during different periods of the year. So that is a big advantage we feel. And this also working together and bringing together programs, we expect will also motivate them, and it will address a sort of a fatigue that can happen if multiple campaigns happen back to back. And also availability of budget, in one way it is an advantage, but it could also be a disadvantage, which I will explain in the hindering factors. Yeah, different can be pooled. We feel budget for different campaigns. So these there could be some hindering factors, such as collaboration could be a challenge of different programmers, could be a challenge, and compatibility of programs. For example, can an immunization campaign be clubbed with a with an NTD, with a deworming program? So these factors could be a challenge which we will have to consider, and budget under different heads could also be a challenge to us. We believe that an approach of collaboration would stand us in good stead during this whole integrative process. For that, we will work closely with different stakeholders in a very well planned out and implemented way. And our role is that of a facilitator who would iron out all the work with different stakeholders, work with the community, work with the government, work with other agencies to try and iron out differences and explore ways. And we will never, we can never forget the fact that we are all learning along as we go on. We've had discussions within the group as to how we would present our findings. Of course, a case study is a deliverable for documentation purposes. We have this typical case study, which would be text-rich, which will give context, methods, field experiences, which will speak about the district background, etc. We will have perspectives of different respondents, and solutions would also possibly, we would like solutions also to come from them. For advocacy purposes, we would use infographics, visual. For example, just an example of a visual, the way forward would be captured as a calendar. If we are going to integrate 3 campaigns, how we would shift the dates to one particular month, what activities would be there in the other months, pre-planning stage, the planning stage, monitoring stage, etc. That would be like marked out. On one side, we will have the challenges. This is just an example what we had discussed. On one side, we'll have the major enabling factors, what are the major challenges that are anticipated, some quotations from key informants, and then budget. What are the budgetary implications that would be there? We would also have for different audiences, different summarized versions. For technocrats, it would be technical content short summary. For bureaucrats, management issues would be highlighted. And for media, another short note would be prepared. And idea-wise, we have discussed many ideas such as short films, documentaries, having a web domain. But of course, all those will depend on the resources we would have.